Today, we're looking at a really powerful idea coming out of Tanzania that's kind of flipping the script on prenatal care. And it's not about some fancy new technology or a miracle drug. It's all about the power of community. And honestly, the results are just revolutionary. So let's dive in. I mean, just stop and think about that for a second. We're always looking for the next high-tech solution in medicine, right? But what if the real key to a healthier pregnancy is something way more fundamental, something almost ancient? The simple power of people going through the same thing together. That's the big question we're exploring here. All right, so first things first, what's the problem we're even trying to solve? Well, to put it simply, there's this huge gap between the kind of prenatal care that experts say women should get and what millions of them are actually getting. You know, the global gold standard is pretty clear. The World Health Organization, the WHO, says that for a healthy, positive pregnancy, a woman should connect with a healthcare provider at least 8 times. 8. And that's so important for catching any potential problems early and just getting that essential support. Okay, so that's the ideal. Now let's look at the reality on the ground, because this is where it gets really stark. Even if we lower the goal to just 4 visits, the national average in Tanzania is only 65%. And in the Geita region, where this whole project happened, it was way worse, only 34%. Just a third of women were getting even that basic level of care. That's a massive gap, and it has real-world consequences for moms and their babies. So how in the world do you fix a problem that big? I mean, you can't just tell people, hey, show up more. It doesn't work. You have to completely change the experience itself. And that's exactly where this idea of group antenatal care comes into play. So what exactly is this group antenatal care, or G-ANC? Well, it's pretty much what it sounds like. Instead of those quick, lonely one-on-one appointments, you bring a small group of women, all at about the same stage of pregnancy, together. And yeah, they get their medical checkups, but they also learn together, and this is the magic ingredient. They support each other. And this really shows you the difference in a nutshell. On one side, you've got the old way. You, alone with a doctor, maybe for 10 minutes. It's all very clinical, very quick. But on the other side, you've got the group model. The clinical part is still there, of course, but it's woven together with education and that super powerful peer support. It turns a medical task into a real community event. So how does it actually work? Well, it's really well thought out. You get a little group, a cohort of about 8 to 12 women. They all stick together for 5 scheduled meetings. And get this, each meeting is about 2 hours long, way longer than a typical visit. And in that time, you get your private checkup, but then you have these group discussions about everything: nutrition, getting ready for birth, how to care for a newborn. They even invite male partners to one of the sessions to get them involved too. Now, this wasn't some tiny little project in an isolated clinic. Nope. Researchers in Tanzania rolled this out in the real world, inside the public health system, to see if this idea could actually work on a larger scale. And this wasn't just a quick look. The study ran for nearly 2 full years, from the start of 2023 all the way to the end of 2024. That long-term view is so important because it gives you a really clear picture of how things are working, not just on day 1, but over time. And the scale here is what's really impressive. They did this across 6 different government facilities, everything from little local dispensaries to bigger hospitals. We're talking about almost 6,000 pregnant women who took part, organized into nearly 150 different groups. I mean, this was a serious, robust test of the whole concept. Okay, so we've got the problem, we've got this really cool, innovative solution, but here's the million-dollar question. Did it actually work? Well, let me tell you, this is where the story gets really good. Let's look at the numbers. Just look at this. It's kind of hard to believe. Remember that baseline number we talked about? Only 34% of women were getting those 4 recommended visits. With group antenatal care, that number skyrockets to 94%. 94! That is not an improvement. That's a complete transformation. It just proves that when you make healthcare engaging and supportive, people want to be a part of it. And the positive effects didn't stop at just showing up. The group model started this amazing ripple effect. Check out these numbers. Over 92% of women were taking their iron supplements. Almost everybody, 96%, delivered their baby in a proper health facility. And malaria prevention, which is a huge deal there, jumped to over 76%. This tells you the groups didn't just give women information. They actually empowered them to act on it. But this is the number that truly matters. This whole thing wasn't just about checking boxes on a form. It was about saving lives. The study found an incredible link. Women who went to 4 or more group sessions had an 88% lower chance of having an adverse birth outcome, like a stillbirth. 88%. That is absolutely life-changing. Now, of course, no study is ever perfect, and it's always important to look at the whole picture. And what I really appreciate about this research is that the authors were super transparent about the challenges, which frankly makes their amazing results even more believable. So one of the main issues was about timing. Because they needed to group women at a similar stage, the program had them wait until they were at least 20 weeks pregnant. The downside? That means very few women, only about 8.5%, started their care in that critical first trimester. It's a logistical trade-off that they'll have to figure out going forward. There was also this kind of strange finding in the data. Women who went to hospitals seemed to have worse outcomes. And you might hear that and think, wait, what? But the authors give us the crucial context right here. It's not that hospitals are more dangerous. It's that hospitals are where the most high-risk, most complicated pregnancies end up in the first place. See? Context is absolutely everything when you look at data like this. So we kind of end up right back where we started, with a big question. This amazing work in Tanzania shows that combining medical care with community is a total game changer for pregnancy. But just imagine, what if we applied this idea to other things, like managing diabetes, or mental health support, or any chronic illness? Maybe, just maybe, the future of healthcare isn't just about what we do, but about who we do it with.